Resuming debate.
Member from Thornhill.
Split my way three ways.
Ton ami aurait pu le dire à la place.
The Fair Price Pharma is a company who got 15 kilograms of imported heroin licensed by Health Canada at some point. Has the minister met with the CEO, Perry Kendall?
The Honourable Minister has 19 seconds on the
I
clock.
have not met with the CEO, but just to be clear, we have not granted a license to Fair Price Pharma. They haven't even applied.
The Honourable Member from Thornhill.
They are in possession of 15 kilograms of imported heroin as a result of a license that was granted by Health Canada, just to be clear. Has anybody in the minister's office met with Perry Kendall?
The Minister has 12 seconds.
I have not met with Perry Kendall, and I will say again, Fair Price Pharma has not applied for a license, nor do they have one.
The Honourable Member from Thornhill.
In the minister's office met with Perry Kendall, yes or no?
The Honourable Minister has 4 seconds.
No.
The Honourable Member from Thornhill.
Has anybody in the office met with representatives from Fair Price Pharma?
The Honourable Minister has 4 seconds. The Honourable Member from Thornhill.
Mr. Speaker, the lobby registry says that on September 15th, 2023, that representatives from the minister's office met with Fair Price Pharma. So can she tell the House if that's true or not?
The Minister has 17 seconds.
To my knowledge, no one from my office has met with Fair Price Pharma.
The Honourable Member from Thornhill.
Does the minister have any idea what is going on in her office and who has met with Fair Price Pharma?
The Honourable Minister has 5 seconds.
To my knowledge, no one on my team has met with Fair Price Pharma.
The Honourable Member from Thornhill.
This is a order paper question from the government, so either the government is not being forthwith with the House, or the minister has no idea what's going on in her office. Now, has anybody from her ministry met with any representatives from Fair Price Pharma? I don't know how long we're going to have to do this.
The Honourable Minister has 17 seconds.
To my knowledge, my predecessor, Minister Bennett, met with Fair Price Pharma, but I'm not sure what member of her team they have met with her.
The Honourable Member from Thornhill.
On September 15th, the minister was actually occupying the office, and the government said that the participation in that meeting was from the minister's office. So was she briefed about that meeting on September 15th, 2023, when she was minister, with the representatives from Fair Price Pharma?
The Honourable Minister has 18 seconds.
I believe I've answered the question previously, and I will reiterate, to my knowledge, and I know I have not met with Fair Price Pharma. If a member of my team has met with Fair Price Pharma, the member already has the answer.
The Honourable Member from Thornhill.
If the minister isn't planning to fund the so-called safe supply of heroin, why is anybody in the ministry, her office, her predecessor's office, meeting with Fair Price Pharma?
The Honourable Minister has 12 seconds.
I have not met with Fair Price Pharma. Our prescribed alternative programs and the drugs distributed are paid for and prescribed by the provinces.
The Honourable Member from Thornhill. And I would like to let her know that she has just over 1 minute.
We are clearly not getting a straight answer from the minister, so I will move on to something that she probably can answer and should answer. She's a minister from Toronto. Her failed experiment in British Columbia that she had to pull back because she was forced to by the radical NDP government there, will she rule it out for good in Toronto forever?
Just say no. The Honourable Minister has 23 seconds.
Mr. Speaker, the member doesn't seem to appreciate the importance of collaborative work between the federal government and jurisdictions in addressing the overdose crisis. We will continue to work with all jurisdictions as per their requests on what we can do to save lives.
The Honourable Member has 22 seconds left.
Yes or no question. Yes or no.
The Honourable Minister has 4 seconds.
The federal government will always work with its provincial and municipal partners to ensure that we address.
The honourable member from Thornhill.
To show that after the next election, if they are elected, they will legalize the same way in British Columbia, in Toronto, that she will do in Toronto that she did in British Columbia. She just basically said yes.
From Thornhill has elapsed her time, but I'll allow the honourable minister to 6 seconds to respond.
We don't work in hypotheticals, we work with facts.
Reprise du débat, l'honorable député.
Resuming debate. The honourable member for Louis Saint Laurent. My question is for the Minister for Mental Health. The government launched a pilot project a few years ago. Can the minister say which province that was in? The honourable minister has 12 seconds.
Chair, the question wasn't clear. If I could ask the member to repeat it, and I will respect the time.
We will take care of that. L'honorable.
The honourable member for Louis Saint Laurent. Which province asked you for a pilot project for the opioid project? Which province?
L'honorable ministre.
The honourable minister in 6 seconds.
Knows BC requested an exemption.
L'honorable député de.
The honourable member for Louis Saint Laurent. The answer is British Columbia. Did British Columbia ask you in the past few weeks to review the pilot project conditions? Yes or no?
L'honorable.
The honourable member has 12 seconds.
From the outset, the pilot program in British Columbia has made a commitment to be monitored, assessed, and be amended as needed. That is why it is a pilot program.
Et avant que le député.
Before the member for Louis Saint Laurent begins, I'd like to remind him that the time it takes for interpretation is not deducted from his 5 minutes. The honourable member for Louis Saint Laurent, thank you very much. Can the minister tell us how much time it took her government to respond to British Columbia's government's request? How many days did it take?
L'honorable ministre.
The honourable minister.
10.
L'honorable député.
The honourable member for Louis Saint Laurent. Does the minister know how many people die on average per day in British Columbia due to the crisis? The honourable minister, 5 seconds.
Yes.
The honourable member for Louis Saint Laurent. How many people die per day? The honourable minister.
6.
L'honorable député de Louis.
The honourable member for Louis Saint Laurent. For 10 days, her government waited 10 days before accepting a very legitimate and urgent request from the government of British Columbia. Is the minister aware of the fact that for 10 days, at least 60 people died because this government waited 10 days before saying yes to their very legitimate and urgent request?
20 secondes pour répondre.
The honourable minister.
Numbers misleading Canadians. People die of overdose deaths due to the illegal toxic drug supply. Decriminalization is simply one tool of many in order to direct people to health services rather than being put through the justice system. I would think that he would not want to stigmatize or criminalize those who need health care.
L'honorable député de Louis.
The honourable member for Louis Saint Laurent. 2,546 people died in British Columbia because of the opioid crisis. How many more people need to die for you to act quicker? A reminder to all members to ask questions through the chair. The honourable minister. In 9 seconds.
This government has dedicated over $1 billion to this public health crisis, as opposed to the opposition, when in power, cut 2/3 of the paltry $60 million that they put towards saving lives.
Député de Louis.
The honourable member for Louis Saint Laurent. Are Canadians right in worrying that you will extend this pilot project to other provinces?
Ministre.
The honourable minister, in 9 seconds.
We are committed to saving lives with a comprehensive strategy that considers every tool and resource available, working with jurisdictions.
L'honorable député.
The honourable member for Louis Saint Laurent. After 2,500 deaths, it seems to me that the government should have understood very clearly that the strategy is not working. The honourable minister, 6 seconds.
The member doesn't seem to be familiar with international jurisdictions that have also implemented decriminalization tools.
L'honorable député.
The honourable member for Louis Saint Laurent. I am the member for Louis Saint Laurent. I know the province of Quebec very well. Quebecers do not want to see the same tragedy that's ongoing in British Columbia. Can the minister rise and promise that she will never apply this project to Quebec? Yes or no? The Honourable Minister, 12 seconds.
We are committed to working in partnership and collaboration with jurisdictions who wish to address this public health crisis with a robust set of tools, just as we have been committed to using evidence expertise to save lives.
The
Honourable Member for Louis Saint Laurent. Well, 2,500 people died because of this pilot project. 6 people are dying per day. What more will it take for you to end the pilot project? The Honourable Minister, 8 seconds.
Every death is a tragedy, Mr. Speaker, but they are dying from an illegal toxic drug supply, not decriminalization, which is a tool that's been used in countries as Germany, Portugal, Spain, Switzerland, and if time allows, I'll continue on the list.
The Honourable Member for Louis Saint Laurent. A quick question, please. Is the Minister familiar with the Benoit Lab Maison House in Montreal? The Honourable Minister.
I am not.
That is all the time. The time has run out.
To the Honourable Member from Bay of Quinte.
Thank you, Mr. Speaker. I'll be directing my questions to the Minister of Mental Health and Addictions. Minister, in Belleville, Ontario and surrounding Bay of Quinte, is there adequate funding and resources for addictions and essential addiction management?
The Honourable Minister in 6 seconds.
As the member knows, health is under the jurisdiction of the province, and they were recently awarded over $700 million towards mental health and substance use in our bilateral agreements.
The Honourable Member from Bay of Quinte.
Minister, aware that in Belleville, Ontario, they reported 240 overdoses in just 11 weeks and 23 overdoses in a single day?
The Honourable Minister has 8 seconds.
I am aware, and as the member knows, I went to Belleville.
The Honourable Member from Bay of Quinte.
Is the Minister aware that Belleville, Ontario had 2 of these epidemic overdoses, not just 1 in February?
The Honourable Minister has 5 seconds.
I am aware, and Health Canada is working with the community.
The Honourable Member from Bay of Quinte.
Is the Minister aware of the opioid mortality rate in the Belleville and Bay of Quinte region?
The Honourable Minister has about 4 seconds.
Federal jurisdiction deals with national data.
The Honourable Member from Bay of Quinte.
Minister know of the opioid mortality rate in Ottawa, Toronto, and North Bay?
The Honourable Minister has 4 seconds.
Ontario is one of the 3 top provinces with high overdose rates.
The Honourable Member from Bay of Quinte.
The opioid mortality rate in Belleville, Ontario is nearly double that of Ottawa, Toronto, and North Bay at 250 deaths per 100,000 people in the first half of 2023, compared to 150,000 per 100,000 people for Ottawa, Toronto, and Hamilton. Does the Minister find that acceptable?
The Honourable Minister has 15 seconds.
As I'm sure every member in this House would agree, no death is acceptable and is tragic and harmful to the families, loved ones, and communities who lose people by overdose due to the toxic drug supply.
The Honourable Member from Bay of Quinte.
Can the Minister state how many bed-based addiction treatment services are in the region?
The Honourable Minister has 5 seconds.
It is under the jurisdiction of the province to implement beds and treatment.
The Honourable Member from Bay of Quinte.
The answer is 0. What's more, the number of opioid poisoning-related ER visits to Belleville General Hospital is more than 3 times higher than the 5-year average. After 9 years, there are no treatment facilities to bring our loved ones home drug-free. What is the government's plan to fund and measure success for the crisis affecting Belleville?
The Honourable Minister has 17 seconds.
As mentioned before, close to over $700 million has been allocated to the province of Ontario to mental health and substance use in the coming years. That being said, in this 2024 budget, the ETF, the Emergency Transfer Fund, offers $150 million over 3 years to communities to seek additional assistance.
The Honourable Member from Bay of Quinte.
Is the Minister aware of the number of Canadians in the Belleville region currently on a wait list, waiting for addictions and concurrent disorder programs?
The Honourable Minister has 6 seconds.
It is under provincial jurisdiction to provide treatment health care.
The Honourable Member from Bay of Quinte.
The answer is over 500 people. Does the Minister think this is acceptable?
The Honourable Minister has 3 seconds.
No.
The Honourable Member from Bay of Quinte.
Can the minister state what government is responsible for the explosive growth of waiting lists for mental health underfunding for the simple fact that there are 0 treatment beds in the entire Belleville region after 9 years?
The Honourable Minister has 10 seconds.
This is why we signed a $3.1 billion bilateral agreement with Ontario with $700 million allocated to mental health and substance use.
The Honourable Member from Bay of Quinte has 1 minute left on the clock.
Is the minister aware of the average wait time for residential addiction treatment and supportive recovery programs?
The Honourable Minister has 5 seconds.
They vary jurisdiction to jurisdiction.
The Honourable Member from Bay of Quinte.
There's 75 days and 175 days respectively. On what date will Belleville get treatment beds, and what will be the measure of success for programs to aid in recovery?
The Honourable Minister has 8 seconds.
That's an excellent question to the Minister of Mental Health and Addictions of Ontario.
The Honourable Member from Bay of Quinte.
And Mr. Speaker, why do we have a federal minister for mental health and addictions if they are not working with the province in providing a date to this House to when we're going to get treatment programs for this city? That's under crisis.
The Honourable Minister has 11 seconds.
For an opposition member who says we should get out of the way of the provinces, I'm surprised that he doesn't appreciate that healthcare is a jurisdictional purview of the province and we should conduct.
And this brings to the end the round of questioning here.